Well, if you've ever wanted to get a coronavirus antibody test but were unsure whether or not you needed one, well, now is the time to look into it. NBC 16's Stephanie Rothman visited a local urgent care and is now live in the studio. So, Stephanie, I understand you're one of those that got a test.
I did. Right here is the mark where it left. It's been a long time in the making, as I'm sure it's been for many people. In early March, I showed symptoms after visiting home in New York. My mother there later tested positive, but I never got the chance to know myself. So, well, right now, I got mine done so you can figure out whether or not you want to get tested and if it's right for you.
This is uncharted territory for sure.
As the world works towards a coronavirus vaccine, many people are now for the first time able to get tested.
Things have changed what we do know, so what we knew 2 weeks ago may not be as accurate as what we know today.
With more people being tested for the virus and its antibodies, the more information becomes available.
Now we're fortunately at a point where we can test, and we want to encourage anyone who has any symptoms to please present to your healthcare professional.
Qualifying for an antibody test depends on 3 factors: whether or not you had symptoms, were exposed to someone who tested positive, and the rate of coronavirus cases where you live.
If you fit all the criteria to get an antibody test, you're going to be doing that by getting your blood drawn. So we're going to be doing that now.
Little poke, 1, 2, 3.
There is no other test, if you will, that's available to help give them that information. It's not perfect information, but it does increase the likelihood that yes, it actually was or wasn't COVID.
If you test positive for antibodies, the results are simply for you to know and help researchers learn more about the virus.
So there's all sorts of ways in how we're learning how to use antibody testing, and for you as an individual, it's one dot in time.
Understanding the past so we can figure out what needs to be done to help patients in the future.
And there are other tests that can help you better understand your relationship or not with COVID-19. The rapid antigen and PCR tests are the ones you've been seeing most done. They're by nasal swabs. They tell you whether or not you currently have the virus, so it's different than the antibodies. Antigen results will come back in 15 minutes, while the PCR comes back in a couple of days. My antibody test results will come back in 4 to 5 days, and we'll bring you more information then. Alan?
All right, thanks a lot, Stephanie.